Hi, this is Dr. Hemmelgarn. I'm going to talk to you a little bit about myself. I am currently a small animal critical care specialist. My education started at Washington State University, which is where I went to vet school. I followed that up with a small animal rotating internship for a year that rotated through multiple specialties, and then following that was a 3-year residency in emergency and critical care. I currently practice clinical medicine, both seeing emergencies on the triage floor and also managing patients in our ICU. I'm also a CEO of IntensiVets. It's an online training platform to improve continuing education for veterinarians and veterinary technicians. Continuing education is a topic that's very near and dear to my heart, and that's one of the reasons why I'm very happy to be here with you guys today. Today we're going to talk about canine infectious diseases. I think it's a topic that's very useful for all of us being veterinarians. It's something we're going to see very commonly, and it's something that should always be on our radar when we see pets that come through the door. So today we're going to give a little bit of a refresher about the cause of different infectious agents, clinical signs we'll see with that, ways that we can treat it, ways that we can diagnose it, in some cases how we can prevent these infectious diseases. In all of these infectious diseases could be a lecture on themselves, so we're just going to give a quick little note today about important things for us to know, and then if it ever circles back that we need to know a little bit more, we could always look it up, but at least we have a refresher and it'll be right on the top of our minds. So the first infectious disease we're going to talk about is canine distemper. Canine distemper is caused by the canine distemper virus. It's spread rapidly among dogs through respiratory secretions, and it affects rapidly dividing cells in the respiratory, the gastrointestinal, and the nervous system. It can affect other animals besides just dogs, including wildlife, cats, and wild cats. The normal course of clinical signs develop with respiratory sign, gastrointestinal sign, and then progress to neurologic signs, but it can be different from each pet depending on severity. The clinical signs that we're mainly looking at are fever, lymphopenia, nasal, ocular discharge, lethargy, vomiting, inappetence, diarrhea, and past the acute phase, they can also develop paw pad hyperkeratosis or enamel hypoplasia in their teeth. The neurologic signs we can see are involuntary muscle twitching, chewing gum seizures, which are a classic sign of canine distemper, generalized seizures, forebrain signs. The diagnosis is done via PCR of sometimes the conjunctiva, the tracheal lining, the vulva, the buffy coat, or bone marrow. And treatment's going to be mainly supportive. So that's going to be treating them for their respiratory signs with things like fluids, antibiotics. Sometimes they need supplemental oxygen. Their gastrointestinal signs, we're going to be treating them with anti-nausea medications, pro-motility agents. Sometimes they do need help with nutritional support through this. And if they reach to the point that they're starting to show neurologic signs, it is something we often have to try to start them on anticonvulsant medications. Unfortunately, the prognosis is very poor if they start to develop neurologic signs, and it is something that is most commonly fatal if they develop neurologic signs. The good news for canine distemper is that there is a prevention. There is a vaccination available. There's both a modified live virus, but there's also a recombinant vaccine that is also available. These vaccines are very successful in minimizing contraction of disease and also spread. Other ways to prevent it is environmental decontamination and avoiding exposure of unvaccinated pets into areas that could have distemper. The next infectious disease we're going to talk about is canine influenza. It's a type A influenza. The strains that mainly affect dogs are H3N8 and are H3N2. It's spread via respiratory secretions, especially in small spaces such as boarding facilities, doggy daycares, doggy play dates, any of those where dogs are going to be close together, sneezing, coughing, it's spread. The main clinical signs we're going to see are going to be our respiratory signs. We can see nasal and ocular discharge, fever, cough, inappetence. All of those are things that we can see. Unfortunately, it is a disease that can progress to a more serious condition such as pneumonia, and unfortunately in some cases it can be fatal in dogs. The primary way to diagnose canine influenza is through a respiratory PCR panel. It's something you can take a respiratory swab in the back of a dog's throat and send it out to a lab. It's very reliable in detecting canine influenza. The treatment options are broad spectrum treatment with broad spectrum antibiotics, supportive care, which includes fluid, oxygen, bronchodilators, and trying to keep them as comfortable as possible while they're getting through this. There is ways to prevent this. There is a vaccination available, and also avoiding areas where you're going to have a high contact of animals spreading respiratory secretions that could potentially become infectious would be the best ways. So that's our quick brief on canine influenza. So the next disease we're going to talk about is canine parvovirus. Unfortunately, this is a disease that's very prevalent in our environment and is going to be something you see a lot in clinical practice. It's a highly contagious virus that's spread via fecal-oral transmission. It starts its replication in the lymphatic system in the back of the throat, but then moves down into the intestinal tract. Its main targets are rapidly dividing cells, the white blood cells, our GI tract. Unfortunately, we can also see it affect their cardiac system and their neurologic system. So the clinical signs of parvovirus are very classic. You're going to see vomiting, diarrhea, and appetence. They can have an elevated temperature. The mortality that's seen with parvovirus is unfortunately secondary to bacterial translocation and bacterial infections. We unfortunately can see a high mortality rate in these puppies, especially ones that aren't treated aggressively. The way that we diagnose a parvo patient is we do have an in-hospital test. It's an ELISA test. You can also base it off of their clinical signs. The treatment is going to be very much supportive. So it's going to be a lot of IV fluids, antibiotics, anti-nausea medications, and treating them supportively. Sometimes they do need pain medication on board. There is a vaccine that can prevent puppies from getting this, and so that's always something we push very strongly for. Other ways that we've been able to have improved success in treating parvo puppies is feeding them very, very early. So this is going to be something that we strongly recommend, placing feeding tubes very early on in treatment. There was recently a study that showed an improved discharge from the hospital in puppies that had a feeding tube placed and were starting to be fed within the first 24 hours of them being hospitalized. There's also some research studies about fecal transplants and them having an increased success of getting puppies out of the hospital and out sooner by treating them with fecal transplants. So this is definitely a disease that we could look into doing fecal transplants for. So the next infectious disease we're going to talk about is canine Parinfluenza. It's another contagious respiratory virus for us to have on our radar. It's a paramyxovirus. It's spread mainly via respiratory secretions again, so that's going to be coughing, sneezing. The clinical signs we see in pets is going to be nasal discharge. They can have pharyngitis and they can also have a fever. They can rarely and uncommonly have side effect signs such as what we see with canine distemper, with gastrointestinal signs and neurologic signs, but those are less commonly than our respiratory signs. The good news is that there are vaccines against this virus. There's an intranasal and an injectable vaccine that's available. So our treatment options for parainfluenza are going to be largely relying on supportive care. So that's going to be IV fluids, especially if they're not eating or if they are febrile. Antibiotics to treat for secondary bacterial infections. Sometimes they are nauseous, so anti-nausea medications. Nebulization, they may need supportive oxygen therapy depending on how severely affected they are. It is something that they can make a recovery from, and so it is something that there can be a good outcome for pets that are affected with parainfluenza. And that's going to be the end for parainfluenza. So we're going to talk about fungal diseases. This, depending on where you're located, it may not be as prevalent as other places. They are endemic to specific geographical regions. We're going to talk about blasto, histo, crypto, and coccidiomycosis are the main fungal diseases that can infect our veterinary patients. They can be seen nationwide, especially due to the fact that rescue and travel agencies can bring pets up to an area that they previously weren't native to. Histoplasmosis is normally seen in eastern and central U.S. Blasto is in southeast, south central, and the Midwest. Crypto is going to be in our Pacific Northwest, and coccidia is mainly in our Southwest United States, but again, it could be anywhere. Clinical signs really could be anything, but you're looking for things that are associated with their respiratory tract, fever. They can also have GI signs, lameness, ocular signs, nasal signs. They can develop abscesses underneath their skin. Their lymph nodes can get really big. The most common way we diagnose it is doing needle aspirates, fluid cytology, CBC, path review, looking at it under a microscope. All of those are going to be ways that we're going to diagnose this. You can send out urine and blood testing to Mira Vista Lab, which is going to look for further determination, and also you can check levels and titers for that. Unfortunately, fungal disease can be very difficult to treat, and it can require a lifetime sometimes of treating them with antifungal. Depending on what signs they're seeing, you're going to treat them initially supportively. So if they have a fever, you're going to treat them with IV fluids. If they're having GI signs, anti-nausea medications. If they're showing any evidence of a secondary bacterial infection, you'll be treating with antibiotics. And then you're going to talk about getting them treated on antifungal medications. So that can be your fluconazole, your amphotericin B. Any of those would be ways to treat it, but it really is supportively and depending on what organ system is involved with it. So the next disease we're going to talk about is heartworm disease. This is spread via mosquitoes in mainly endemic areas, but can be all over the United States. It's spread by Diarrhea immitis. It takes about 6 months for it to complete a full lifespan. Therefore, if puppies up to the age of 6 months, they can be started on heartworm preventative medications without needing to be tested. If they have not been routinely on heartworm preventative or they're older than 6 months, they need to be tested for heartworm before getting started on heartworm preventative medications. So the treatment guidelines should be based off of the recommendations from the American Heartworm Society. That often includes melarsoline injections, oral doxycycline, and also starting preventatives based off of veterinarian preference. Cavil syndrome is a syndrome we can see in dogs that are severely affected by heartworm disease. It's a life-threatening condition, unfortunately, that's caused by a mass of heartworms that are located in the right atrium, ventricle, and vena cava. The worm burden gets so large that it starts to interfere with the closure of the tricuspid valve and then impedes normal blood flow from going around the rest of the body. It can also cause anemia secondary to the shearing of the red blood cells as they're going past all of the worms. Treatment in this case is a little weird and a little odd, but it's actually surgical extraction of the worms. That's something that we commonly recommend to refer out to a cardiologist, but you can do it in a practice if you're comfortable with that. The prognosis is guarded if they're starting to show signs of Cavil syndrome, unfortunately, just due to the anesthetic risk of going under anesthesia to have the worms removed, but also the secondary organ function and failure that can happen afterwards. They can also have pulmonary hypertension and permanent cardiac changes depending on how severe their disease is. So unfortunately, heartworm disease can be something that can be fatal in dogs depending on the severity of their worm burden and how early on in the disease process we catch it. So it's always good to be proactive about testing dogs that have been in endemic areas or have not been routinely on heartworm preventative so we can aim to get them treated before they get to these end stages. The next we're going to talk about is some more respiratory diseases, starting with Bordetella. So we're going to talk about infectious tracheobronchitis, or what's commonly known as kennel cough. It's a respiratory bacterial pathogen. It's caused by Bordetella bronchoseptica. So Bordetella bronchoseptica is spread via aerosolized particles from the respiratory tract of infectious dogs to other dogs. So again, we're going to see that in areas where dogs are heavily populated, doggy daycare, grooming facilities, play dates, any of those. The most common clinical signs we see associated with it is what a person describes as a honking cough. So if your dog comes in that they either say that they're trying to clear their throat or they have that sort of dry, hacking cough, that's going to be something that's going to put kennel cough very high up on your radar as a potential cause of this dog's clinical signs. It's a disease in which doesn't necessarily need to involve treatment unless it's in very young patients or older patients or potentially patients that have other comorbidities or are immunocompromised. It's something that a healthy dog should be able to clear on their own, but if you are going to elect to move forward with treatment based off of your individualized patient, then getting them started on a treatment of antibiotics, mainly doxycycline, but you can also reach for things like a beta-lactam. All of those would be a viable treatment option for them. And you want to make sure that the patient's improving with treatment and that if at any point it seems like they're worsening or feeling worse, so having a fever, not wanting to eat, acting lethargic, The next step would be to do x-rays to make sure that they don't have bacterial pneumonia secondary to this. It's a disease process that should resolve very quickly with treatment and has a very good recovery, so patients should bounce back very quickly as they're clearing the disease or during treatment of the disease. If they are not at any point, then it's always important to reach back and look to see if there is something else going on with them, or again, whether they're developing pneumonia. The next disease process we're going to talk about is the Canine Infectious Respiratory Disease Complex, or CIRDC. Clinical signs associated with that are going to be sneezing, nasal ocular discharge, and lower respiratory disease, so coughing, pneumonia signs. All of those are clinical signs we could see with this disease complex. The viruses that have been implicated in this disease complex include Parinfluenza, which we talked about a little bit earlier, adenovirus 2, respiratory coronavirus, herpes virus 1, pneumovirus, Canine Distemper, and Canine Influenza. So all of these viruses that I mentioned can all play a part in that canine infectious respiratory disease complex that we're going to talk about. There's also some bacteria that can play a part in this disease cycle, which can include Bordetella bronchoseptica, which we talked about is the main agent associated with kennel cough, mycoplasma, and strep zooepidemicus. All of those are ones that can contribute to the disease process. The main treatment for this disease is supportively based off of clinical signs. So that's again going to be IV fluids if they're not eating or they're febrile, anti-nausea medication. Sometimes when they cough so much, it'll make them then want to vomit. So treating nausea can help a lot with these guys. And then treating with a good course of an antibiotic, doxycycline or a beta-lactam would be a very good choice for that. Again, in this case, there are vaccines available for a lot of these different viruses that can help minimize the spread of this disease, but also minimize your pets from developing the disease. So for prevention for this disease complex is going to be to minimize exposure. So if you have a dog that's very social, that's going to doggy daycare, getting grooming frequently, or being out and about where they potentially are exposed to other dogs that are infectious, it's always good to make sure that they are vaccinated for diseases that we have vaccines available for, but to always try to minimize exposure. If your pet is not feeling well, to prevent them from spreading it anywhere else, but to also minimize exposure if there are other animals in these social environments that could be spreading them. And if at any point in a veterinary facility you're noticing that there is an uptick in these cases, then making sure you're practicing very good hygiene in your veterinary practice. A lot of times with these guys, if they're coming in, we can do curbside management of them to prevent them coming into your hospital and preventing them from spreading this aerosolized to other pets within the hospital. So all of those things are very good to minimize the spread of disease. That's it for CIRDC. So the next disease we're going to talk about is leptospirosis. Leptospirosis is spread via wildlife. Unfortunately, dogs and people can be exposed by ingestion of water that has wildlife urine. It's really disgusting, but that's how this disease starts. Usually it's stagnant water sources, so people are less likely to drink water from stagnant water sources, where dogs find that very delicious. So the disease is caused by bacteria of the Leptospira genus. Depending on the geographical region, different serovars are more prevalent, including Pomona, Bratyslavia, and Ictrohemorrhagia. The clinical signs are variable. Most reliably, the clinical signs you're going to see in these patients is going to be lethargy, vomiting, inappetence, and elevated liver and kidney values. Unfortunately, this is a disease that can progress to anuric renal failure or fulminant liver failure, and in those cases, their prognosis is very poor, making a recovery from that. Some dogs will develop pulmonary hemorrhage or bleeding into their lungs, and you'll notice a coughing or respiratory signs also associated with this disease process. They can have coagulopathies associated with it, and that can be due to secondary decreased production of clotting factors from the liver failure, or it can be secondary to a thrombocytopenia from the bacteria, unfortunately, itself. The acute phases of the disease that you're looking for need to be treated supportively with IV fluids, antiemetics. They tend to be very nauseous with this disease, gastroprotectants, liver protectants such as N-acetylcysteine or Denamarin if they're eating, and antibiotics. Penicillin is usually going to be our first choice in the acute phase, and then you would want to transition them to doxycycline. In severe cases of kidney disease or injury, dialysis is something that would be discussed and recommended, especially if they're in anuric renal failure. That is one way we've been able to try to get them to make a recovery from that. Unfortunately, again, this is a disease that has a zoonotic potential, so it is something that we have to be cautious of our employees in our veterinary hospital and also our owners and ourselves, that it is something that unfortunately we can contract lepto from the environment, but also from our patients. So being very, very diligent about good hand hygiene is going to be very important, especially when you're handling their urine in the hospital. So for tick-borne diseases, we're going to talk about the infectious agent, we're going to talk about what tick spreads it, and what cells they normally affect. So the first tick-borne disease we're going to talk about is anaplasma. It's the Izotes tick that normally spreads this, and it's normally going to affect your granulocytes. So that's going to be your neutrophils, your eosinophils, your basophils. Your anaplasma is by the Rhizophilus tick, and that's mainly going to affect your platelets. So for Ehrlichia, that's going to be the Rhizophilus tick also, and that's going to be our mononuclear cells, so our lymphocytes and our monocytes. Our Rocky Mountain spotted fever is Rickettsia rickettsii is the infectious agent, and that's going to be mainly affecting our endothelial cells, and that's the dermacenter tick. The Borrelia burgdorferi, that's going to be our Lyme disease, and that's again our Izotes tick. The clinical signs can vary wildly depending on which tick-borne disease a pet is affected with and what cell line, again, they are affected with. For diagnosis of tick-borne diseases, we do have the SNAP ELISA test, which is going to test for the most common tick-borne diseases, but if you are concerned about something that's slightly out of the realm of more common, you can always send out a PCR tick titer to some of the more common laboratories and look to see if any of them come back as being positive. The treatment universally is going to be supportive care depending on what clinical signs that patient's showing, but also getting them started on a 2 to 3 week course of tetracyclines. Prognosis is variable depending on the severity of clinical signs and how well they respond to treatment, but it is something they can make a recovery from. So that was a quick review on canine infectious diseases. I'm Dr. Carey Hemmelgarn. You can follow us at IntensiVets on social media. Please like and share this video. Thank you so much for joining us today, and we hope to see you again on another video.